Why nothing happening is often our goal. Beatrice was a Jack Russell Terrier with a small body and an outsized personality. Her people called her B or BB or BT, Big Trouble, because she was always getting into something she shouldn't. When I met her, she was 2 years old, bright-eyed, coiled with energy, and impossible to keep still on the exam table. Her owners laughed as they asked, when might she finally slow down? And I laughed too and told them the truth. A Jack Russell may never slow down. She was there for a preventative care visit, the kind people hope for. A young dog, no complaints, no red flags. She was due for her rabies vaccine and routine yearly blood work. Simple. The kind of appointment that can feel almost unnecessary and that everyone leaves smiling. It was also the appointment that saved her life. The physical exam itself was a bit challenging. Bee never stopped moving, but nothing obvious stood out. She was happy, alert, strong, heart was good, everything looked great. If medicine relied only on what I could see, the visit would have ended there. But at our AHA accredited hospitals, we recommend yearly blood work because animals hide disease. Listen up, they hide disease. We don't just test for heartworm. We also run a complete blood count and a chemistry panel to check for organ function. Animals are not like us. They don't tell us where it hurts. In the wild, appearing sick makes the group vulnerable. So animals evolve to mask illness for as long as they possibly can. By the time they look sick, something has usually been wrong for a while. When Bee's blood work came back, the story changed. Her kidney values were not normal. Both her BUN and creatinine were elevated. On paper, these might look like mild elevations, but kidneys do not have that much room for error. She was also anemic, meaning that her red cell count was low. This was not a dog who was doing great. This was a dog compensating remarkably well. I asked her owners to bring in a first morning urine sample. What many people don't realize is that across species, is that kidney function often shows up in the urine before it appears in the blood. By the time the blood values change, the problem has usually been present for quite some time. Bee's urine contained glucose. That's sugar. And sugar in the urine is unusual. Sure, it can mean diabetes, but in this case, it wasn't. It can be associated with an infection or this rare condition called Fanconi syndrome, which Jack Russells typically don't get. So something just didn't fit right. So we did further testing, and that gave us the answer. Bee had lead toxicosis. Her kidneys weren't failing because of age or genetics. They were being poisoned. And the exposure didn't stop with her. Once we knew what we were looking for, her owners were tested. The cat in the home was evaluated as well. The source turned out to be the lead in their household water. One preventative care appointment uncovered a problem affecting multiple species living in the same environment. Bee was treated. Her family was treated. Luckily, the cat was fine. And the water was treated, last but not least. And a crisis that no one knew was brewing was stopped before it announced itself in irreversible ways. I see versions of this pattern all the time, not just in dogs, but in cats, horses, and people. A cat who seems a little picky turns out to have early kidney disease caught on routine labs. A horse who's just slowing down may have metabolic changes that can be managed if addressed early. Humans, too, often discover hypertension, diabetes, environmental exposures. During exams, they almost skip because they felt fine. The shared insight is simple, but easy to overlook. Good medicine is often invisible. Prevention is the absence of crisis. We tend to judge care by how dramatic it looks: an emergency surgery, an ICU stay, heroic saves. But the most effective medicine rarely looks like that. It looks like a normal day, a routine test, a problem found quietly before it becomes loud. It looks like nothing is happening, and that is exactly the point. When this is misunderstood, care gets delayed. People wait until a pet acts sick. By the time an animal shows obvious symptoms, they've often been compensating for weeks or months. Treatment becomes more expensive, more invasive, and less certain. In fact, in B's case, if prolonged lead exposure continued, that could have progressed to kidney failure. Managing kidney failure can take days to weeks, and even then, we may not even be able to save the patient. Prevention isn't just kinder, it's more humane across species. Cases like B's have changed how I practice medicine. I spend more time explaining why we recommend tests when nothing seems wrong. I frame preventative visits not as boxes to check, but as opportunities to look under the hood, and I ask better questions about the pet's environment, not just their appetite or energy. I also set clearer boundaries about what I can and can't promise when disease is advanced versus when it's caught early. And I remind myself and my clients that Google cannot replace a physical exam. A physical assessment paired with diagnostics gives us information symptoms alone never will. Animals can't tell us what hurts. Blood, urine, imaging, that speaks for them. What I wish every pet owner understood is this: preventing disease is almost always less expensive, financially and emotionally, than treating it. More importantly, it preserves options. Early detection gives us time to intervene gently instead of aggressively, time to protect not just one patient, but sometimes an entire household. Yearly veterinary visits aren't about expecting bad news. They're about confirming that things are truly okay and catching the rare but meaningful moments when they're not. They're about building a baseline so subtle changes don't go unnoticed. B never looked sick. I examined her. She was fine. She never slowed down. She never warned anyone. And yet, her body was telling a story that only preventative care could hear. Prevention looks boring because nothing happens. But sometimes, nothing happening is the most powerful outcome we can hope for.